Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by microbiologist. I hope all of you are well and fine. Today in this video lecture we are going to see another lecture that is related to the glucose test, and it is about the HbA1c test. If you guys remember, we already talked about different glucose tests, like we have talked about blood sugar test, we have talked about glucose challenge test. Okay, now this is the third or fourth video lecture, that is the HbA1c test. So we are going to see HbA1c test now. If you guys remember, we already talked about the HbA1c test practical video lecture, but we didn't talk to the detailed video of the HbA1c test. Okay, so today in this video we are just going to see that what is HbA1c test, diagnostic purpose, each and everything in detail. I will show you into the next slide that what we are going to explain in this video. So my name is Muhammad Kamil Khan and you guys watching my channel Microbiologist. Let's start the video. So in this video lecture, what we are going to explain, first of all we are going to see that what is HbA1c test, what is the diagnostic purpose of HbA1c, what is the test procedure, then we are going to see the normal range, and finally we will see the main causes of high and low HbA1c test. First of all, what is HbA1c? The full form of the HbA1c is glaciated, or we can say that glycosylated hemoglobin concentration. Now let's see that what's going on in this process. In this process, normally what will happen in our body, the glucose molecules which we get from the food, so what will happen, the glucose molecule will enter into the bloodstream. After that it will bind to the hemoglobin, that is the protein of the RBC, okay, which can carry the oxygen, and this glucose will then transfer to all part of the cells which are needed for the energy. Now what will happen, all of you better know that when the glucose molecule are break down, so then it will release the energy, and all of you better know that energy is needed for the body to do work. Next point says that if let's suppose the glucose level get high, so what it will do, it will cause to bind the glucose to Hb means hemoglobin, and what will happen, due to this way the HbA1c level will also get high. So this is a short introduction related to the HbA1c test. Let's see the diagnostic purpose of the HbA1c test. Now this test is specially used to check the appropriate treatment, means through this test we can easily understand that what type of the treatment should be needed for the patient, and due to this test we will be also make sure that either the treatment or the medicine for the glucose or for the diabetic patient which we are providing, either it is working or not. Okay, so through this test we can make sure the treatment effect as well. Next, that due to this blood test, what we will be make sure, due to this blood test we will see or we will measure the level of the glucose over the past 2 to 3 months. Now let's see the requirements. So in this test what we need a fine care machine. So this is the FIA machine, means fluorescence amino assay machine. You need any type of the fluorescence amino assay machine for this test. Okay, so we need a fine care machine with the strip. As you can see it, this machine contains the strip and this is the chip. Okay, then you need blood in the ADTA tube. Okay, after that you need the yellow tape, you need personal protective equipment, you need white tip, and you need pipette. Let's see the procedure. So I already explained the test procedure practically, so if you wanted to see, I will provide the link into the I button, so then you will check it. Okay, remember guys, the procedure of the test is different lab to lab, as well as it is different kit to kit. Let's suppose if you are using low FIA cure machine, so in this case the test procedure will be different. Means you need 10 microliter of the whole blood and you will mix it into the buffer, and then from the buffer then you will take 6 to 5. And whenever you are using digrade, so I already explained, means digrade need 80 microliter mixture. Okay, means you need 5 microliter of the blood, whole blood, and you will mix it into the buffer, and then you take almost 80 microliter and will mix it. So if let's suppose you are using fine care machine, in most of the laboratory we are using fine care machine. So if you are using fine care machine, what will you do? You take the blood and will collect it into the agitate tube. Then you will take 10 microliter of the whole blood and mix it into the buffer 10 times. Then you will take 75 microliter and put it into the cartridge or strip and will incubate it for the 15 minutes at room temperature. After that you will read the strip in fine care, quick or standard. If let's suppose you take the incubation into the incubator machine 15 minutes, so then you will run it quickly. Or if let's suppose if you okay, I write it 15 minutes, but in the fine care you just need 5-minute incubation. Okay, you need 5-minute incubation, not 15 minutes. Once the 5 minute is done, so then you will run it quickly. If let's suppose you didn't take 5-minute incubation, so in the machine of the fine care you will just click on the standard machine. Let's see the normal range of the test. Now the normal range is if let's suppose you see that the test value is less than 5.8%, so it means the patient is non-diabetic, or we can say it is normal. If let's suppose you see that the value is 6.0 to 7.0, it means that the patient is pre-diabetic or patient have controlled diabetic. If let's suppose you see that the value of the result is more than 7.0%, it means that the patient have uncontrolled diabetic, or we can say the patient is a diabetic patient. Okay, let's see the main causes of high HbA1c. So it is due to the diabetic mellitus, and it is also due to the poor control of the sugar. Means if those patients who are diabetes and if they are not controlling their sugar level, so obviously their HbA1c level will get high. Due to the corticosteroid medicine, okay, if you are using corticosteroid medicine for the treatment of the inflammation, all of you better know it is used for the inflammation treatment. So what will happen? It will affect on the pancreas, and due to this way what will happen, the insulin level will be decreased, or we can say it will affect on the insulin level, and due to this way the glucose level will get high and it will increase the HbA1c level. Next we have physical inactivity, or we can say obesity. So what will happen if let's suppose you are eating food and you didn't doing any type of the exercise? So what will happen, the glucose molecule will be not break down and the energy will be not released. So due to this way the obesity will be or we can say weight will be gained, and due to this way we can say the patient is obesity, and due to this way the HbA1c level will get high. Next we have the heart disease due to the polycystic ovary syndrome. Polycystic ovary syndrome is the condition especially in the female, mostly into the female. So what will happen in this case? In this case the ovaries will the ovaries have water, and the ovaries do not have the ability to produce eggs, or we can say ova. Moreover what will happen, due to this syndrome the female have long menstrual cycle, or we can say that they have menstrual cycle for a long time. And moreover due to this way mostly the female do not have the ability, there will be no fertilization into the female. So in this polycystic ovary syndrome we can also say that another hormone, that is the male hormone, we call that androgen level, will also get high. Next we have Cushing syndrome. So Cushing syndrome is the disease of the hormone, in which we can say that cortisol hormone is secreted. We also call it stress hormone. It will be secreted, and what will it do? It will affect onto the insulin level, or it will affect onto the pancreas, or affect onto the insulin level, and due to this way the glucose level will get high and it will increase the HbA1c. So this is all about the high HbA1c. Now let's see the low HbA1c causes. So the low HbA1c is due to the hemorrhage. It is due to the hemolytic anemia. Hemolytic anemia means when, let's suppose, the RBC level, when the RBC are lysed and when the HB concentration get low, we call that hemolytic anemia. Next we have increased use of the diabetic medicine. If the patient are continuously using the diabetic medicines, due to this way the HbA1c level will get low. Due to the strict diet plan, if let's suppose the patient are having a diet and not eating any type of the food for a long period of time, so what will happen there? HbA1c level will also get low. So dear viewer, this is all about the HbA1c test. I hope you get idea about that. Thank you so much for watching. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting videos like that. Thank you so much for watching.